Hi, everyone. I'm Cassie Adams, Care Services Director for ALS Northwest. I'm so excited to be here with everyone today. This is one of the first of many sessions that we're going to do, just kind of talking about the basics of ALS, what it is, and symptoms, and the kind of support that ALS Northwest provides. So we'll go ahead and get started. And um, want to just first share that today we're really going to dive into what ALS actually is, the diagnostic process, common symptoms, treatment options, and the kind of support that ALS Northwest provides as it pertains to our services, research, and advocacy. And finally, we'll share some resources where you can continue to learn more about ALS. So what is ALS? ALS stands for Amyotrophic Lateral Sclerosis, which is a big mouthful, basically meaning no muscle nourishment translated into Latin. It's also commonly referred to as Lou Gehrig's disease. So ALS is a condition where nerves that control movement break down and essentially stop working. So these nerves are called motor neurons, and they are in all of us. They connect the brain and the spinal cord to our muscles. And as ALS progresses, motor neurons lose the ability to function and eventually die. As a result, people with ALS experience muscle weakness, atrophy, which means that the muscles shrink, and a loss of muscle control. And we'll talk more about this, but while no two cases of ALS are alike, people eventually lose the ability to walk, talk, eat, and eventually breathe with this diagnosis. So next, I'd like to share some facts about ALS. Based on population statistics here in the United States, a little over 5,000 people in the United States are diagnosed with ALS every year. That's about 15 new cases a day. It's estimated that about 30,000 Americans have the disease at any given time. Here in Oregon, around 430 to 450 people are living with ALS at any given moment here in Oregon and Southwest Washington. And our organization supports around 600 people living with ALS every year. ALS prevalence varies by region. It's estimated to affect approximately 2 to 4 people per 100,000 in the general population. ALS is a global phenomenon, and it impacts people in various countries and regions all across the world. The incidence of ALS refers to the number of new cases that are diagnosed in a given population within a certain specified period. The incidence of ALS is estimated to be around 1 to 2 cases per 100,000 people every year. ALS primarily impacts adults and are at risk of developing the disease does increase as people age. It typically strikes people around midlife between the ages of 40 and 70, although that can be variable. And ALS impacts slightly more men than women, although that seems to even out as people get older. A small percentage of ALS cases, which we'll talk a little more about this, about 5 to 10% are what is known as familial ALS. This is where the disease is inherited within families due to a genetic mutation. However, the majority of ALS cases are what we call sporadic, which means there is no specified genetic link. So we've kind of touched on this already, but I just want to share a little bit more about who gets ALS. This is typically one of the most misunderstood questions when it comes to ALS. Why does one person get this diagnosis where another person doesn't? And to be honest with you, we still don't have a lot of answers. What we do know is that ALS commonly impacts people between ages 40 and 70. Average age of diagnosis is typically around 55. We talked about that ALS is more common in men than in women, although that seems to even out the older the person is. We talked about the genetic link, and this is we'll talk a little bit more about this in the research part of this presentation, but this is where research has definitely made the most advances, and we're likely going to see more treatment options come out that are targeted towards the genetic variants of ALS. Also, for reasons that we don't understand at this point, veterans who served in the United States Armed Forces are at an increased risk of developing ALS. As I mentioned, the connection between the military service and ALS is still being studied, but veterans who are diagnosed with ALS because of this are presumptively eligible for 100% service-connected benefits through the VA. So we always encourage people to reach out to us and to the VA if they receive a diagnosis, as it is considered to be a 100% service-connected disability. So what causes ALS? This is probably everyone's number one question. As we've talked about, ALS impacts the nerve cells in the body that control voluntary muscle movement. Motor neurons that extend from the brain to the spinal cord, which are the upper motor neurons, and from the spinal cord to the muscles, which are the lower motor neurons, begin to atrophy and die. This results in a loss of signal from the motor neurons to the muscles and makes it so that people can't walk, talk, breathe, and eventually also be able to speak. So it's really important to emphasize that while all of this is occurring in the body, ALS is not contagious, meaning it can't be transmitted from one person to another. Ultimately, the cause of ALS is still unknown. While we do know that approximately 5 to 10% of people have a familial or genetic form of ALS, the 90 to 95% of folks who have ALS are what is referred to as sporadic. So we still don't understand what causes those individuals' ALS. There are many, many theories out there around risk factors and potential causes, but the truth is that we still don't have any definitive answers. And the only way we're going to get there is through expanded research. So what is the diagnostic process for a person with ALS like? So ALS is a diagnosis of exclusion, and that might be something that you've heard before. What that means is that there's essentially no one test for ALS. Other conditions have to be kind of checked off and excluded prior to being able to make a diagnosis of suspected or confirmed ALS. So it's a very complex and often lengthy process, and it typically involves a series of medical assessments, tests, and consultations with various healthcare professionals. A typical, if you can say a typical diagnostic process, may include having a clinical evaluation. So meeting with your primary care doctor, potentially eventually a neurologist or a neuromuscular specialist to do a thorough evaluation of medical history, doing a physical exam, and really diving into what a person's symptoms are. A pretty key diagnostic test is an EMG, or a nerve conduction study, which is basically inserting a fine needle into the muscles that record electrical activity. This can help identify changes or abnormalities in the function of motor neurons and muscles. It's also very common that people will do MRIs or CAT scans, blood and urine testing, and it's becoming more commonplace to do genetic testing as well. So the diagnostic process for ALS relies a lot on clinical criteria, presence of different signs and symptoms, and it's very complicated and complex. It's always our recommendation to get a second opinion because of the heaviness and weight of receiving a diagnosis like ALS. It's very, very important for people to talk to various specialists and really get their questions answered. Okay, so now we're going to move on to ALS symptoms. So we've talked a little bit about what happens, but ALS is very complex in that it can look really different from person to person. In some cases, cognitive functioning can also be impaired. So it's really important to note that everyone's progression is different, and what is one person's experience may not be another person's experience. Generally speaking, though, one of the first initial symptoms that people notice is muscle weakness. It often begins in a specific part of the body, like a hand or a leg. Weakness impacts the ability to perform everyday tasks. So around 60% of cases begin with weakness in the arm or the leg. And that can look like trouble holding onto a pen, or it can look like drop foot, having a harder time walking. About 30 to 35% of cases are what are referred to as bulbar onset. These symptoms are generally including changes in speech. It can look like slurring speech. It can look like weakening in the muscles in the throat, which can result in trouble swallowing and choking. And then much more rare is what's referred to as respiratory onset. So this is the weakness in the muscles that help us to breathe. So ALS, generally speaking, doesn't impact lungs or lung capacity. It impacts the diaphragm. And our diaphragm muscle is a muscle that allows us to get a good deep breath in and breathe out, cough, all of those sorts of things. But it's much more smaller percentage of people who have respiratory onset. Generally speaking, the main symptoms that we see people with ALS eventually experience in some form are muscle weakness and atrophy, mobility changes. So that can look like an inability to grab, lift arms, walk, or eventually move your body. Muscle cramping and fasciculations is a word that you may hear, and this refers to some twitching that happens in the muscles. Some people experience some cramping in their muscles, or what's called spasticity, and it's kind of a tightness in the muscles. Changes in speech, swallowing, and as we talked about, breathing. And unfortunately, eventually, most people with ALS do experience each of these symptoms. So as the diagnosis progresses, we've talked about that ALS can look very different from person to person. And what's also true is that the rate of progression can vary pretty significantly from person to person. After a diagnosis is established, we really encourage people with ALS to seek follow-up care from a multidisciplinary clinic. We'll talk a little bit more about this in a minute, but it's a team of healthcare professionals that really help support and navigate the progression of the disease with the person and their family. What we do know about ALS is that the average life expectancy on average is 2 to 5 years from diagnosis. However, we do see people that live far longer than that, sometimes upward of 10 years or more. So I wanted to take a minute to share a little bit about some of the research that has been done on cognitive symptoms and ALS. So current research shows that about 50% of people with ALS experience some change in thinking or behavior, whereas 50% may not experience any change in cognition at all. And research has highlighted kind of this involvement of cognitive function in ALS, that some people may experience kind of on a spectrum ranging from like mild executive dysfunction to more severe conditions, which we typically with ALS refer to as frontal temporal dementia, or FTD. FTD is a distinct type of dementia that can occur in relation with ALS or on its own, separate from ALS. And there is a recognized clinical overlap between ALS and FTD. Both conditions share common genetic factors, and a subset of ALS folks may exhibit symptoms that are consistent with FTD, which can look like changes in personality, behavior, and ability to process certain types of language and speech. So FTD, as mentioned, it's a dementia that results from the breakdown of the frontal and temporal lobe systems of the brain. It typically has shown in some research to impact about 20% of people with ALS. And again, what they've really shown is that cognitive symptoms are very much on a spectrum. Some people may not experience cognitive issues whatsoever, or so mild that they're hardly noticeable. But we do know about 20% of people have what is called FTD. Neurologists can help answer questions about that condition and help make that diagnosis. I also think it's worth mentioning a condition called pseudobulbar affect. And this is not just seen with ALS, this is seen with other conditions as well, but can impact some people with ALS. What it is a kind of an uncontrollable outburst of laughter or crying that becomes really difficult for that person to control. And it's often not proportionate to the person's actual emotional state. You'll talk to somebody with this condition, they usually say, yeah, I might have heard something funny and I just started laughing and I could not stop, even though it wasn't funny to me anymore. I just kept laughing and laughing and laughing. This is definitely a condition that we encourage people to talk about with their neurologist. There are some treatment options on the market to help manage those symptoms. Okay, so next I want to talk just briefly about some of the treatment options that are on the market for ALS. While ALS does not have a cure, there have been 3 approved drug treatments in the last decade or so. Unfortunately, recently, one of these treatments was pulled from the market, so we'll touch on that. Riluzole is, or brand name is the Rilutek, was approved in 1995. It's a pill that's generally taken twice a day, and it was shown in clinical trials to extend life expectancy for people with ALS by around 6 to 9 weeks. There was quite a long period of time where we didn't have any conditions or any treatment options for ALS. In 2017, edaravone, which is called Radicava, was approved. And that is a drug that's pretty consistently taken by folks with ALS. And an oral version of that medication was approved in May of 2022. In September of 2022, a new medication called Relyvrio was approved by the FDA, but unfortunately it didn't meet its endpoints in trial, and so it recently became pulled from the market. We're really hopeful for more successes in the future, particularly as research around ALS continues to move forward. So talking a little bit about another type of intervention or support for ALS, multidisciplinary care. In fact, studies have shown that actually the specialized multidisciplinary ALS care has been shown to extend survival and improve people's quality of life by almost up to a year. So not only does the multidisciplinary ALS clinic provide access to interventions and care support, but they're also crucial to helping people with guidance as the disease progresses. The multidisciplinary care model includes essential clinicians who offer that support through the progression, and we have a list of those providers up on the screen. It typically involves a neurologist, a nurse who is kind of the main point of contact for the person living with ALS in between clinics as well, a respiratory therapist, occupational and physical therapist, speech pathologist, a dietitian, a social worker, a pulmonologist, and I think very importantly, a care services coordinator from ALS Northwest. It's a pretty long appointment. It's typically about 4 hours. But even though those days are long, in the end, we hear frequently that it's easier for someone to make a single clinic visit rather than scheduling with each provider separately. Additionally, a benefit of this clinic team is that the medical providers work to really coordinate the care of the person living with ALS and actually meet after their clinic appointment to talk about their treatment and make recommendations. So next, I'd like to share a little bit about ALS Northwest. So our mission as an organization is to provide comprehensive support and advocacy for people with ALS and their families, while also advancing research for new treatments and ultimately finding an end to ALS. One of the ways that we do this is through our programs and our services. We support people living with ALS all throughout Oregon and Southwest Washington. We also support people with offsets of ALS, primary lateral sclerosis, or PLS, and progressive muscular atrophy, also known as PMA. And one of the ways that we do that is through our care coordination. Our care coordinators are really the heart of the organization, and they help to support people living with ALS through home visits, through support groups, and really help people navigate throughout the entire diagnosis what their options are. So as I mentioned, one of the primary first things that we offer to people is a home visit. And it really is the beginning of a personalized one-on-one relationship that can involve frequent conversations and support for the person with ALS and their whole family. And it's really all about how can we support that person to live their life as fully as possible and offer whatever resources or supports that we can do and provide to that person to get them there. So I won't go through every single program that we have because we have a lot, but I do want to mention just briefly some of the support that we offer through ALS Northwest. So one of the ways that we connect in with people is our partnership with ALS clinics and centers. We work very closely with the medical team to make sure that people are getting consistent and supportive care through the clinics and through ALS Northwest. We also have a medical equipment program that serves the entire state of Oregon and Southwest Washington to help fill gaps in medical needs in accessing pieces of equipment that might not be covered through insurance or are delayed because of the insurance process. We have an augmentative communication and assistive technology program, frequently referred to as AAC and AT, and we offer really practical solutions, loans, and equipment support to people around communication and technology access. We offer financial assistance grants. We offer caregiver support programs to make sure that those who are supporting a loved one with ALS have their own needs being met and resources and supports that are crucial for their understanding and knowledge of the disease and how to support their loved one. We offer support groups for people living with ALS, family members, friends, and anyone who just wants to learn more. We offer support for youth and families. We understand that this diagnosis doesn't just impact one person with ALS, it really impacts an entire family system. So we really try to work with the family, including children under 18, to help get them the services and support that they really deserve to be able to navigate this diagnosis. All of our support groups are available in person and online. We recognize that getting to a physical support group is not always possible, so we want to make sure that we're meeting people where they're at and have options for everyone. We also have education programs and do outreach to community partners and healthcare professionals in the community, because advocating and sharing more information about this diagnosis is really crucial to putting an end to it. We also offer bereavement support services for families and opportunities for volunteers and helping hands. So I want to just touch on research. As an organization, we really make it a priority to support the most hopeful research projects and really foster creative collaboration, whether it's across government, other nonprofit groups. Really is about guiding and finding the best research possible to find a cure for this disease. We've got a pretty long list here of some of the research projects that we have supported over the years. I'll highlight two of our most recent projects that we've helped fund. Dr. Jeff Rothstein with Johns Hopkins University in Baltimore. We helped to fund an investigative study around CHAMP7 as a novel therapeutic approach for ALS and FTD, which is that condition we talked about earlier. We also helped to fund Dr. Dan Fowler through RAPA Therapeutics, developing a cell therapy for ALS. So funding research is a huge task. It requires enormous collaboration and a huge amount of funding. So a big part of what we also do for research support is through advocacy. With advocacy, we really try to focus on championing policies that really work on improving the quality of life for people living with ALS and their families, but also increasing funding for research. Research has to go through quite a number of different steps, all the way from the lab bench to clinical trials, to centers, to going to market. So it takes a really long time and it takes funding. So a big part of what we have found through advocacy is that real change really comes from the active engagement of people living with ALS and their families going through that process with us. Whether it's funding or seeking funding and continued funding for the Act for ALS Act, establishing presumptive disability for Social Security to waive the 5-month waiting period, to connecting veterans with those service-connected benefits. All of those things have been made possible based on advocacy from the ALS community. And advocacy efforts really never stop. We really encourage anybody who's interested in getting more involved in advocacy, whether it's going out to meetings or writing letters from home. All of it is hugely important and very significant for moving us forward for better care and finding a cure. I've so appreciated the time that you've all taken to learn more about ALS and ALS Northwest. There's so much to learn when it comes to ALS, and there's always continued new discoveries in terms of research and an never-ending really list of resources and supports that are out there. We really encourage folks who want to learn more to check out our YouTube channel. We have lots of videos, educational resources, recordings of our past research symposium presentations. We also encourage you to check out our website. We have resources pertaining to a lot of the topics that we've talked about today, as well as information on managing symptoms. And ultimately, please also reach out to us here in the office. We love to talk with folks and share information and resources, and would love to have a conversation with you. So feel free to reach out to us at the email that's provided here, or go on our website and find one of our team members, or just give us a call. We're always happy to talk and share more, and we're really excited to continue with this series and come back with more learning opportunities, and very much welcome folks' questions and thoughts. So thank you so much for listening today. Again, we're really appreciative of your interest in learning more about ALS, and it really truly takes an entire community to support this population, and we just really value your support. Thank you so much.